Good afternoon, everyone. Welcome to the Healthcare Leadership Panel discussion, the third annual NorCal Symposium on Climate, Health, and Equity. My name is Dr. Aude Boignon, and I'm a neuroscientist and medical student at UCSF.
Hi, everyone. I'm Jenny, and I am a second-year PT student at UCSF and SFSU's joint DPT program.
And I'm Lila Blaylock, and I'm a second-year medical student at UCSF.
Thank you so very much for joining us this afternoon. Each of us comes to this work from a different place and perspective. For me, I'm passionate about applying cutting-edge science to the interconnected health, environmental, and social issues of our time. Early in my medical training, I learned about the complex health issues in Bayview Hunters Point, a San Francisco community long exposed to toxic nuclear waste and disproportionately harmed by poor air quality. I realized the critical importance of addressing environmental inequities to achieve health equity, and I'm committed to partnering directly with impacted communities to expand health access and alleviate preventable illness and suffering caused by environmental hazards and structural racism, both locally and globally.
And I'm so glad to see everyone here today. As students, we're excited to convene this symposium each year as an opportunity for our institutions to discuss these issues and have a discussion with our healthcare leaders on how we can do more. One of the reasons for why I joined this symposium as a committee member is because I felt that this would be a great opportunity for me to advocate for climate justice as well as health equity, while also being able to learn more about it. And today we all have the opportunity to do just that. The climate crisis is unfolding rapidly, and we must bring all of our resources to bear on this problem. We're so grateful to you all for joining us and grateful to our speakers for joining us today in this important conversation.
And I'm also just really excited to be hearing from our speakers today. I came to the symposium with background in medical anthropology and an intention to dedicate my journey through medicine towards health equity. In undergrad, I saw how intertwined climate change is with power, racism, and health, and came to medical school to hopefully see how healthcare structures can be directed towards environmental justice. And now I get to be learning from these healthcare leaders and experts today. I'm going to do some quick introductions of our amazing panelists so we can jump straight into the conversation. Each of our speakers has a long and impressive history in health and healthcare, and we couldn't do it justice in a few words, so we'll be putting the longer bios in the chat for people to read. First is our moderator, Kathy Gerwig. Kathy is a corporate sustainability advisor and former vice president, employee safety, health and wellness, and environmental stewardship officer for Kaiser Permanente. Thank you for being here. We also have Suresh Ganesakaran, the president and CEO of UCSF Health, as well as Vivian Yi Huang, who is the co-director of the Asia Pacific Environmental Network. Paul King is also here. He is the president and CEO of Stanford Children's Health. And finally, David Lebarski, who is the CEO of UC Davis Health and vice chancellor of Human Health Sciences. Thank you all so much for being here. I'm really excited to hear what you have to say. And I'll turn it over to Kathy to start off our conversation.
So much. I am really delighted to be here with this impressive panel and looking forward to the conversation. We will have time at the end for Q&A, so be sure to track your questions, and we hope to get to as many of them as possible. So I'll also give my welcome to our panelists and experts, and let's just dive right in with question number one. I'm going to be asking each of the healthcare CEOs to respond to this one. David, we'll start with you. Each of your institutions has made pledges for decarbonizing your healthcare and ensuring that your facilities are climate resilient in the face of worsening disasters. So coming out of these pledges, what are the goals for sustainability of your system in the coming decade? And what plans are in place to ensure that the goals are being measured and met? So David, please, let's hear from you first.
Sure. Well, I'll try not to step on any of Suresh's toes because a lot of this comes out of the central dictums, very good ones, of the university president's office. Recently released a set of priorities that included accelerating our 2030 carbon neutrality goal to 2025. And this is appropriate. We've been making tremendous progress. We've been ahead of schedule. And rather than celebrating that, we are doubling down and trying to improve that and move to fossil-free operations across the entire University of California system, UC Davis being no exception. We've been very proud as a land grant organization and been at the forefront of climate action for some time. Thanks to Chancellor May and his team on the main campus, UC Davis has been ranked as the most sustainable university in the US for 5 years running. And they are constantly working to improve that level of sustainability. And with a school of agriculture that's environmental sciences that's in the top of the country, it's not surprising that we would be leading that because it's a real focus for our research. Secondarily, following in those trailblazing footsteps of our main campus, this year UC Davis Health was one of the top 25 hospitals in the US, and in the top 10, these are the highest rankings you can get in the top 10 in terms of climate impact. So we think that we're doing our part as well. And that's according to Practice Green Health, which is probably the major organization. So we're continuously working on greening our healthcare facilities, every single facility going up, and we have approximately $8.5 billion worth of construction over the next 7 years. So it's a lot to replace many of our ancient structures. Will all be totally green and have net zero carbon emissions when built. And we hope to get rid of fossil fuel before they're even online. So we have a very aggressive target. Proud that we're the second healthcare system in the entire United States to sign on to the UN's pledge to net zero, and that is very similar to the AAMC's pledge. So we've been all in all the time and about this, and as President Drake told me when I was crowing about UC Davis Health's achievements, he said, David, that's really good, but healthcare is the worst emitter in the world, with 8.5% of all carbon emissions in the US coming from healthcare. You shouldn't be satisfied with being a top hospital. You need to be a top organization. And that's our next step, is not to just be a really good healthcare organization, which in general are terrible contributors of greenhouse gases, but to really be a leading organization amongst all industries.
Thank you. I love that coordinated leadership and tying it directly to your mission as foundational to the achievements. So thank you for that. Paul, let's ask you the same question. What are your goals for sustainability in the coming decade, and what plans are in place to ensure those goals are being measured and met?
Oh, thank you, Kathy, and thank all of you for asking us to join you here. You're very ambitious for a Friday afternoon seminar at 4 o'clock. So thank you for being here. At Stanford Medicine, which is the adult and children's hospitals along with the School of Medicine, we've chosen to support the pledge as a formal commitment to sustainability. In many aspects, we've already gone above and beyond the commitments in the pledge, and we've crafted our organizational goals. For example, the pledge aims for a 50% reduction in operational greenhouse gas emissions by 2030. Our adult hospital is already committed to carbon neutrality for its main campus by 2025. We'll reach the goal through a combination of projects to reduce greenhouse gas emissions associated with natural gas and steam, and by purchasing carbon offsets. Our children's hospital is evaluating projects such as capturing heat from thermal fluid heaters, adding anesthetic gas capture systems for our operating rooms, and evaluating options for alternate steam generation. Both hospitals have also already completed comprehensive greenhouse gas inventories that includes our supply chain emissions. Regarding net zero emissions by 2050, we're developing projects that include reducing reliance on natural gas, energy efficiency to reduce consumption, and water conservation opportunities. Examples in addition to those already mentioned include LED lighting retrofits, optimizing HVAC systems, and adding meters so that we can better analyze and identify opportunities for energy reduction. We're also developing infrastructure to support the reduction in single occupancy vehicle trips and strategies to encourage adoption of electric vehicles. Last year, we launched a South Bay Park and Shuttle ride. We're also looking into purchasing electric vehicles for the fleets for each of our Stanford Medicine entities and adding electric vehicle charging stations across our campus. An important element of our strategy is to develop an environmentally preferred purchasing policy, which will address emissions from our suppliers. That's a segment that currently makes up 77% of our overall emissions. From a waste standpoint, both hospitals have committed to zero waste by 2025 for our main campus. To achieve this goal, we're developing programs that ensure proper separation of recyclable materials. We're working collectively on our climate resiliency plan. This collaborative effort will address our own preparedness for climate-related emergency events, as well as the needs of our greater community that we serve. We'll be bringing together our Sustainability Program Office, our Office of Emergency Management, Community Benefit Team, and organizational leadership to develop this plan. We recognize, as you do, that only what gets measured gets done. We're holding ourselves accountable for meeting these goals by providing ongoing updates to our community and to our respective hospital boards. And finally, each entity is working toward publishing its first annual sustainability report in 2023.
Thank you so much, Paul. Wow, neutral in 2025, very impressive. And thanks for sharing your supplier share of emissions at 77%. That is a significant hurdle. So we'll be interested in hearing more about that. Suresh, how about you? What about goals at UCSF and how you're measuring and ensuring that you're going to be achieving them?
Yeah, once you go third, it's like everyone stole your thunder. But first, I'd like to certainly thank all of you for the invitation for us to participate in this forum. It's Friday afternoon, but I think this is an important topic, and certainly appreciate my esteemed colleagues on the panel really doing wonderful work at their institutions. And at UCSF, we've certainly thought about these issues for many years and started an office of our Center for Climate Health and Equity years ago to kind of focus us on how we can bring the various different themes together. But I would start at the top with reiterating what David brought up, that at the University of California system level, including all of the campuses, there's a goal about achieving carbon neutrality by 2025. And we've been on that march at UCSF for years, and we hope to reach that goal. First, as Paul mentioned, I think it's important to measure, and we've been tracking our progress annually by calculating and publicly reporting our carbon emissions to the UC Office of the President, the Climate Registry, the Climate Leadership Council, and Practice Green Health. Our facility staff and energy team are actively working to improve our energy performance year over year to meet the 2% reduction per year policy. We're also working to transition away from using natural gas. In fact, we have a new surgery center and clinic being built now at Mission Bay that'll be all electric with 100% carbon-free power. We're also designing a replacement hospital at Parnassus with the goal of all electric or mostly electric power. But our journey isn't without challenges. There are trade-offs in this journey. And as we think about the worsening climate disasters around the world, we think about it locally and regionally as well, and worry a lot about whether environmental disasters are going to render our facilities potentially without the necessary redundancy. And so we're very proud that we have triple redundancy through multiple sources at all of our clinical sites. But with that redundancy also is a reliance on one central power plant that still runs on natural gas to generate electricity. And it's probably our biggest challenge and hurdle in achieving the kind of carbon neutrality that we'd like. And we're actively looking at how to remediate that. And we've got planning underway at this time. But our team is also looking at other aspects, which is working with our campus on developing a plan to decarbonize not only the central plant, but to ensure that all of our assets across the city meet the same standard. But as was mentioned by one of the students to begin this, I think that there's also an aspect of this that we need to work with our community and partner with our community to make sure that those that are most disproportionately affected by climate change are also receiving adequate support and resources and access to healthcare and the services that we need. And we're very proud to be an anchor institution dedicated to providing economic support of diverse and local vendors, which make our community more resilient. And we're also working through a UC-funded program to hold workshops with staff and community partners on improving climate resilience of our communities during climate risks such as extreme heat, wildfires, poor air quality, and flooding. In essence, I think a lot of the UCSF approach moving forward is to be a partner in the city to helping organizations that work with us achieve these goals as well.
Thank you. And I'm glad you brought up the natural gas being the biggest challenge. And I'm thrilled to hear that your group is taking a good hard look at that for innovation. And nice segue, because I'd like to bring Vivian into the conversation on that issue about communities. So we understand that climate change is a health threat multiplier for low wealth communities and communities of color who have contributed the least to climate change. And we're also seeing these communities experiencing some of the worst health effects. So Vivian, as a leader of the Asia Pacific Environmental Network, please tell us more about how communities are facing these climate threats. How can healthcare institutions partner with communities to mitigate and navigate these threats?
Yes, thank you so much, Kathy. So I work at Asian Pacific Environmental Network, and we have been organizing in communities like Richmond and Oakland, Chinatown for many decades. I want to lift up today just some of our work in Richmond and some of the direct experiences that community members have faced in the shadow of the Chevron refinery that is based there. So first I want to just share a story. This actually comes from one of our youth members who's now actually become a staff member at APEN. Her name is Christina Saturn. She was born and raised in Richmond, and she's never lived anywhere else. And she wanted to share in a statement that, I've made many memories here throughout the years. And one memory in particular I will never forget took place at my elementary school when we used to do routine drills in case of an oil spill from the local Chevron oil refinery. We were directed to line up single file with a piece of napkin over our nose and mouth as a teacher walked us over to a specific area. I was about 5 or 6 years old, so at the time I didn't really know how these chemicals are so harmful to a young child's body. To think about it now is very scary. A piece of napkin was going to save my body from the toxic pollution that was spreading through the air. And I wanted to start with a story because I think that for our community members like Tina, they're growing up in a situation where this toxic pollution has been emitted into the air for a very long time. And we know that these are sources, right, of the causes of climate change. And for community members like Tina, growing up in these kinds of conditions has resulted in a lot of health impacts. We see a lot of high rates of cancer and a lot of passings of community members from cancer. We see a lot of respiratory illnesses and asthma, right? And so that's sort of the baseline of what a lot of people are really experiencing. Even as we're seeing, increased multiplier, increased threats that are being multiplied. So we saw during the COVID pandemic, right, that having underlying respiratory and asthma made you increased risk of COVID. We see now that when we have wildfires with the poor air quality, when we have the extreme heat, all of these are exacerbated even more by the underlying impacts from the air quality issues that communities have been experiencing for a long time. And so I think for our community members, they're very much in tune with the need to really respond to climate and to promote climate resilience, but in really a larger framework of fighting for climate justice, really understanding how climate, the economy, and racism really intersect and have created a lot of the conditions for these really terrible impacts, climate change impacts on our community members. And so I think that for a lot of our communities, they're very excited and have a lot of visionary solutions about what they would like to see in their communities to really build resilience. And thinking of resilience beyond just the climate disasters that tend to get a lot of the headlines, but really what does resilience look like on a day-to-day level? How are communities able to stay in the housing that they've grown up with, and not be pushed out by displacement and gentrification threats? How can they be able to seek assistance and resources from trusted places that they already know in their community when there is a climate disaster? And then how do they receive the ongoing supports that they want to see for their thriving neighborhood? So these are some ways that our communities are really seeing some of the climate threats, and the ways that we would like to think about how to partner with healthcare institutions to really support and advance a lot of their solutions and their community-based solutions to address this big issue.
Thank you, Vivian. Thank you for that story and for surfacing that air pollution and climate change connection, because we often hear about climate solutions being something that's in the far future, but you can get immediate health benefits from reducing air pollution today through some of the same steps. So thank you very much for that. David, on this same topic of engaging communities that are most impacted by climate change, what plans does UC Davis Health have in place, and what are you considering around incentives for engagement, addressing vulnerabilities, funding, providing platforms for stakeholders to communicate? If you could enlighten us.
Sure. So that's thank you. That's sort of a softball for us, because we have so many faculty who are truly dedicated to understanding the impacts, especially of things like air pollution and other environmental health exposures on chronic disease in underserved communities. We actually have a what's called the Environmental Health Sciences Center, which is dedicated to studying the relationship between environmental science and health, and understanding not only how it influences disease, but also the development of disabilities in utero, because there is an association given exposure to chemicals and toxins. And all of this actually flows back to climate change, because climate change obviously impacts water supply. It definitely impacts forest fires. It absolutely impacts air pollutants. And understanding what the burden is on various different communities is really important. And so we have a community stakeholder advisory committee for this actual center, which is made up of community groups who are specifically concerned with water and air quality related to climate change, environmental justice, and other toxin exposures. And that has helped drive community-based projects, which include the effect that water quality has on human reproduction, the economic cost of pesticide-related intellectual disability, and the health impacts of air pollution near the Salton Sea, as well as a actual fire institute that has probably 20 major clinical studies ongoing, looking at the particular short-term but incredibly deleterious effects of high small particulate matter inhalation, asthma, et cetera. So we really have a very organized approach to the science. Here's the problem. I'm sadly sure that we will find that the underserved communities are disproportionately impacted. They are disproportionately underserved in terms of central air conditioning, expensive air filtration systems, a lack, an exacerbation of climate change, temperature stressors due to the fact that it's an urban concrete jungle, and the nice parks and green canopies that we see in suburban communities don't exist in those underserved communities. And so I think that the role that academic medical centers can play, we can't fix all the social injustices in the world, but we can shine a light on what the impacts are of those historic underinvestments. We can make it clear that this is an issue around equitable health outcomes across the entire lifespan of these communities, which obviously have a higher mortality rate and lower life expectancy for a variety of both diseases and overall. And we can maybe push as advocates, educational only in the case of UC, push as advocates for greater investment in things that will mitigate climate change harm in underserved communities. I think that's kind of what our approach has been, because this is an issue urban architecture and urban revitalization, it has to be a community-based political solution, drawing on the common resources of the entire area.
Thank you so much. And thanks for bringing in that social and environmental determinants of health that is so important. Paul, let me turn to you now. We've seen record-breaking heat waves and wildfires in Northern California, as well as power shutoffs. How has the team at Stanford Children's been thinking about preparations for climate resilience in your surrounding community that could be affected by these outages, particularly given concern that the outages could grow worse, more frequent during times of extreme heat and wildfires?
Thanks, Kathy. We're actively developing resiliency plans, which include evaluating backup power and system redundancy to ensure continuity of care during power outages and other emergencies. I think you would probably expect that from a healthcare system. Additionally, we're engaging with our Office of Emergency Management and Community Benefit Programs to determine how we can expand our climate resilience plans to support high-risk members of our community. This outreach would include things such as strategies for communicating preparation essentials to our community members, and examining how we can partner with our local government to provide support for those in need of power to ensure their health and safety during these power outages. Our Office of Emergency Management regularly participates in local health fairs to promote emergency preparedness planning and helps to educate communities on their own personal preparedness. We partner with PG&E and participate in their medical baseline program, which is an assistance program for residential customers who depend on power for critical medical needs. Through this partnership, we connected PG&E with some of our transplant colleagues, who then shared that information and resources with our patients to raise awareness of those opportunities. We plan to expand this work to better engage the community this year. Preliminary discussions have included integrating emergency preparedness information into our My Health app to encourage our patients and their families to prepare for disasters and connect them with resources like the PGE program. Additionally, we've been trying to better understand what we could do to set up resources such as cooling centers.
Thank you so much. Suresh, how has UCSF Health advanced climate education among your students, clinicians, staff, and among those you serve? And what has been successful, and how are you thinking about expanding these initiatives to all professional healthcare programs?
Sure. I think we're at UCSF continuously evaluating our curriculum and modernizing it as relevant and for this generation of learners. And I think that there have been curriculum development efforts in our School of Medicine, School of Nursing, School of Dentistry, School of Pharmacy, and they continue to advance. But there are limitations within time and resources because those curriculums are pretty stacked as it is. And so we've had to think more innovatively about how we approach this. And to be honest, one of the greatest changing forces within our community has actually come from our students and really where they're driving us in terms of opportunities to do this. And we have a UCSF advisory committee on sustainability that has representation from all the schools and administrative departments who bring back decarbonization initiatives to their specific schools to further our work on campus. Our Center for Climate Health and Equity that I mentioned before is working to develop tools for clinicians, students, and patients to learn and share information about climate impacts on health so that they are more resilient to events such as extreme weather and wildfires. Our students, as I mentioned, continue to drive a lot of work. They've created toolkits for climate resilience to wildfires and poor air qualities. Other learners have sought to reduce the energy demand of imaging equipment by changing practices and purchasing less energy intensive equipment. Yet another student group created Interview Without Harm to encourage medical schools and residency programs to provide remote interviews to reduce air travel and provide equity for less affluent students. Lastly, one effort that I really took note of was one student group created the Planetary Health Report Card, a metric-based tool for evaluating and improving planetary health content and practices in health professional schools. But by the third cycle, over 80 schools in 7 nations have participated. You know, what I liked about that student effort was we did not get an A. at UCSF. In fact, we started with a C+, we've moved up to a B+, and if you know anything about us, those are not grades we like. So we still have a little bit of work to do, but I'm told by the team that we will move into the A range. But I suspect just when we do that, we'll have another group of students that change that scorecard and continue to move the bar higher. And so I think we're really welcoming this discussion amongst our community. The other thing I'll also point out is that we learn a lot from other academic medical centers around the country. Certainly the other University of California systems, certainly Stanford and the work that they're doing. So this is really a team effort. I don't think one institution is working on curriculum alone, where we're all sharing best practices across the board.
Thank you very much. I look forward to seeing you progress on your report card. Vivian, let me come to you now. Research can be a powerful tool to understand the nature of problems and to study the effectiveness of interventions, but it can also miss opportunities to engage the community effectively. So what advice do you have for researchers on how to partner effectively with environmental justice organizations to understand health inequities that are created and perpetuated by climate change?
Yeah, thank you for this question, Kathy. I think one of the most important kind of overarching principles is for researchers to really recognize and address the power inequity that exists, right? So I should actually naming that up front and really knowing that there is that power differential and really recognizing that and owning that is a really important baseline. And then I think some other principles that feel really important are, one, I think having a principle around really valuing and respecting the worth of lived experience, and that community members actually bring a lot of expertise, and having like the research and the institutions really lift that up and respect that and value it for the worthiness that it deserves. Second, I think, is the importance of really having deep collaboration. And so I think a lot of times research studies can be set up where people are participants rather than really engaged more from the beginning around some of the actual research design and the way that I think that we can think about, how ground truthing happens and really like surfacing, a lot of the lived experiences that people have. I was actually reflecting on an example where we were partnering with some technical assistants, like resource experts, and they were going to be presenting at a meeting with our members, and just how much I think that our organizers really needed to work with them and in a lot of ways challenge them around what actually were better ways for them to actually approach the presentation and to really like engage and include community members more in that discussion and design. Another principle that feels important is really being transparent and open. We've also had the experience, where we had a research partner that was never able to share anything with us in writing. So we were never able to access like the grant proposal, the budget, things like that. That are actually, I think that to have a true collaboration, it's really important to be transparent about information. And then finally, I think is feels really important to inherent in any relationship, right? To actually be open and responsive to feedback. And so to really create that culture of partnership, where there are opportunities to really learn and engage and grow from that partnership. And that requires, I think, an openness and honesty, including, being open to feedback that community partners may have. So those are some principles that I wanted to share that I think are really important to any collaboration between researchers and community institutions. Great,
thanks. Very specific, really appreciate that. Thank you. Well, I am going to move into a last question and give everybody an opportunity to answer this. I'll start with our healthcare CEOs, and I'll begin this time with you, Suresh. So this symposium is planned each year by students that are concerned about the climate crisis, and they're asking their leaders to do more. And you've already talked about that a bit. As you look ahead to what you've done and what needs to be done, what would you say about UCSF Health's commitment to solving the climate crisis?
It's a really good question. Two things come to mind. One is, we've talked a little bit about this, is that the climate challenges that we're facing continue to reinforce health disparities and health inequities that are widespread, pervasive, and very difficult to unroot from our system. And I think that one of the things that we're really thinking about is how we work beyond the walls of UCSF to attack that, because what we see over and over and over again is that these problems are interconnected, and although they may intersect on our doorstep, we don't control all the cards. And when it comes to finding solutions, we might be creating some of the problems centrally, but to unpack this, we're really going to need community partners, and our role as an anchor institution is important. But I also think that we're blessed with a lot of Bay Area partners that are willing to work with us to at every turn, whether it's with public transportation, whether it is with access to services for chronic conditions, whether it's building and housing credits that continue to be an important part of the equation. I think that's one part. And then sometimes, I think the thing for us on our campus is to stare down some of the big, hairy problems, which are that, we're going to be able to build a lot of new buildings and build our way into sustainability with newer buildings and technologies and those things, but you still have to remedy the sins of your forefathers. And so we do have, in a very compressed city block up in Parnassus, this central utility plant that only hasn't been replaced because it would be a tremendously difficult project from an infrastructure standpoint to do in the middle of the city. And I think we have the resolve to be innovative, to do the tough thing, but more importantly, to do the right thing and deal with that central utility plant over the next decade. I think that to do that, it will require a lot of experts from around the country to help us modify that technology and make it appropriate. And I think that that's another piece of this, is that we don't want any piece left behind that continues to do this. And so those would probably be the two areas that I would emphasize that are on the top of our mind to move forward. And none of it's going to be easy, but we're very committed to trying to follow through on these things.
Thank you so much for that. Paul, what would you share about Stanford Children's commitment?
Well, first of all, I think in the healthcare business, we are in the business of health. When you think about it simplistically, healthy people need a healthy planet. I think the link between climate and health is increasingly clear, and our organization is committed to reducing our own impact on climate and helping our community to prepare for climate impacts. Some of the details of which I've already shared with you. We've established opportunities to partner with students in our work, and I look forward to their ideas on how to innovate and help drive behavior change that will have a positive impact on greenhouse gas emissions in the future. For students and residents, we're working to ensure opportunities to research sustainability topics during their educational years. We also welcome student projects as part of our sustainability program framework.
Thank you very much. David, how about UC Davis Health's commitment?
Right. Well, I think that the most important thing to make the leaders do more is for us to constantly be pressed to make sure it is at the top of our list every day for every decision. Because we do have a responsibility to the earth and to the people who will inhabit it long after we're gone. And there is an old quote. It's now 25 years old, but it's as true today as it was a quarter of a century ago, which is that we're living on this planet as if we had another one to go to, and we don't. And it's really critically important that our students and those who will be living with what we leave behind push us to leave a better world than we have. So I think that's number one. And we do that by training the next generation of leaders, by teaching the next generation about how to think about environmental justice and climate change. And so these students, I thank them. I didn't thank them at the beginning. I apologize, but for pushing us. I think that that's really critical. And if you don't, my 23-year-old daughter, who's pursuing a career in sustainability, pushes me every day about trying to do a better job, to keep doing a better job, because I think that we get a little bit unfocused on this as leaders of trying to balance all the needs of every single patient. We really need to be moving upstream on this and making sure we're not dealing with the impacts of heat waves and droughts. We have an Institute for Climate Change and Human Health. We need to get upstream of that so that the communities most at risk of suffering from drought and heat waves and forest fires don't get impacted in the first place. And we need to work closely, as I've said, with legislative and other political bodies to make sure that those communities get what they need to stay safe and keep healthy before they manifest signs of human disease. And we need everybody who's listening here to push for that as well. Advocacy from trusted physicians, especially academic physicians from these three organizations, or four, because Kaiser's here too, hold great sway among the population and their leaders.
Thank you so much for that. Vivian, to slightly reframe this question, what role should the folks engaged in this symposium, what role should each of us play in addressing the climate crisis as we think about how it perpetuates health injustices?
Yes, I think what I want to start out with is really challenging and pushing all of us to continually follow the lead of frontline community members, really grounding our solutions in assessing like who benefits and who's impacted, and really listening to the voices and the solutions that a lot of frontline community members are elevating and amplifying in this moment. So that's the first thing. The second thing is I really want to echo what Suresh said about working beyond the walls of your institution. I actually have a public health background, and I remember as a student, one of my biggest kind of critiques, I guess, or feedback was feeling that my public health institution didn't do enough to actually use our power and our influence and our expertise to really change and shape policies that get at the root of problems beyond our institution. And so I think it was David, you mentioned about how, yes, I think healthcare providers, doctors hold a lot of positional power and influence in our society. And I think it's so important that not only do you all view yourselves as physicians, as scientists, as academics, but also as organizers on this issue. And organizers who are going to be fighting for the solutions that frontline community members are putting out, as if our lives depend on it, because it does, right? And some of the root causes that we are definitely focused on are, one is really addressing fossil fuel infrastructure and fighting for direct emissions reductions at the source. So how do we make sure that when we're talking about greenhouse gas emissions, that it doesn't become a math game, that it's actually about addressing the places where those emissions are occurring and having huge impacts on the health and well-being of community members that live in vicinity. And then second, also, we know that we also want to be building the thriving communities and healthy communities that we know everyone deserves. And so I always like to pair that we're not only fighting against the things that are negative, but we're also building the vision and the new things that we think our communities deserve. And so a lot of our work is focused on really building resilience hubs that are central and woven to the fabric of our communities. I'm really talking about resilience in this broad way of thinking about community resilience and the importance of community connection and community organizing as part of that. And so, yes, we definitely want all of you to be joining us as organizers in this climate justice movement, and to really be following the lead of frontline community members as they're advocating for direct emissions reductions, improvement of air quality, and creating resilience, at a community local level.
Thank you, Vivian. Well, thanks so much to all of you for all your thoughtful comments. We have quite a number of thoughtful questions that have come in during the presentation. And so I'll be looking for you to volunteer if you'd like to answer them. So let me start with the first one. It builds on what a couple of you have already been talking about around being anchor institutions. But the question that came in is, each of the organizations here today is pursuing ambitious goals to green their operations and supply chains. Each is a dominant player in their community and in the California economy. How can these anchor institutions lead beyond the health sector and use their trusted roles to spur action beyond their boundaries? So who would like to take that one?
Well,
I'll jump in.
Go ahead, please.
I'll just jump in. I think one of the things that I think all of us have mentioned during our comments so far this afternoon, it talks about accountability and really shining a light on what we're doing and where we're having success, and quite frankly where we're failing. That probably is even more of an informative point. So I think as we talk about our accomplishments, our goals, and our commitments, and holding ourselves accountable by being very public and very transparent about what we're doing, I think that then spreads the message beyond our four walls and beyond the four walls of our own industry. So I think it's sort of saying what we're going to do, doing it, and then making sure that people know that we've accomplished the goals, or quite frankly, that we may have failed and why.
Thank you, Paul. David, did you have some additional thoughts on that one?
Yeah, I just think it's, part of it is just making sure, as I said, that it dominates your thinking as an important corollary. And I'll give an example. I was on the governor's task force for Alzheimer's disease a few years ago, and it was before research came out, unfortunately, that showed that air quality has a quite important relationship to the development of Alzheimer's disease and also for autism in utero, predicting that as well. And so I would have loved the opportunity to, when they were talking about, well, what are we going to do to address this burgeoning issue, is to bring it back to, well, there's a climate impact, there's an environmental impact, there's a disparate effect impact of climate change on the development of these very important diseases that we were discussing. And I think taking that opportunity is really really critically important, and just whenever we get a chance, to making sure that we're knowledgeable. So what our organization's doing, we need to stay knowledgeable, be up to date about what the impacts of environmental issues are on human health, and to constantly weave that into the advice that's sought from us on a regular basis.
Thank you. Let me move on to another question, and Suresh, I'll target you with this one. How is your system weaving in climate change education across all levels of medical education, including postgraduate healthcare provider education? And how are you supporting clinical research on climate change impacts on health?
Yeah, I think that we spoke a little bit about this in our earlier conversations, and I think that for us, we have a Center for Climate Health and Equity, and I think that has really been the fulcrum of how we bring the pieces together on our individual campus. But I think there's probably three themes. One is across all of these health professional schools, how can electives and others take advantage of these themes that come in two different ways, intersecting, like David brought forward, the direct impacts to chronic conditions associated with climate change, but then separately, a lot of the themes that Paul brought up that they're talking about at Stanford as well, about this notion that our healthcare system is intertwined with sustainability and achieving it moving forward, and what's our specific role. And for us, a lot of this is looking at waste. What we have looked for in terms of efficiency has been a lot of single unit packaging for a lot of our different areas, and our safety agenda has pushed that forward, and that's a tremendous use and waste opportunity for us. And we are deeply engaging not only our educational groups, but also our research groups to really look at strategies to better employ a more equitable supply chain, both for us financially and for us environmentally. And I think that's really the key point here, is that if we don't advance the knowledge base around this, it gets very economically unsustainable to walk a journey of environmental sustainability without government incentives. And what we want to do is to figure out where can that win be immediately, where doing the right thing for sustainability checks boxes of both environmental sustainability and financial sustainability. And we really feel like that's an opportunity to bring everyone in the healthcare workforce together to look at opportunities to reduce waste.
Thank you for that. Here's an interesting question about working with patients, and any of you, including Vivian, love to hear your thoughts on this. So the question is, any initiatives underway or thoughts on partnering with patients to increase their activation, to advocate with their elected leadership and create policies that address climate change, given the links between climate change and its effects on health? Vivian, I'll see if you have any comments, and then open it up to any others.
Yeah, I would love to know if there are some initiatives underway. I will say in our membership base, there's a very strong connection between what people's lived experience have been around connecting the health impacts that they experience and their family members experience, their communities experience, with the toxic pollution that's coming out of the refinery in that community. And so I think that for many of our members, there actually is a strong interest and association that people make around, a lot of times it's like part of our advocacy, wanting to also include advocacy for healthcare access and making sure that our communities have access to healthcare institutions because of that deep connection, unfortunately, between the air quality of our community and all the very negative and terrible health outcomes that people see. So I would be really interested in hearing if there are some initiatives to really partner with patients in this way. Obviously, the members we work with are also patients of healthcare institutions, not necessarily the ones that you all represent, but and often they're like public institutions, like county hospitals or county health systems, and so it would be interesting to know if there are models of how healthcare institutions have been able to deepen that connection.
Would any of you like to take that, work with patients on how to make them better advocates?
I might just say that it's not only patients, but it's our own staff who are maybe a slight step ahead in terms of, because they're living through our commitment. And we've really engaged UC Davis health staff in as Suresh was saying, tremendously engaged in reducing the waste they see all around them. Now, that may only impact landfills, although plastic production increases the emission of greenhouse gases also. But we've eliminated tons of greenhouse gases, and by actually doing what we said last time. I know people remember, but last year there were different people on the call, but we said anesthesia was really contributing to greenhouse gases, and we've eliminated through almost all of the UC now the use of desflurane, which has like 10 to 20 times the emissions of another common anesthetic, sevoflurane. And that's just one thing that we talked about doing here. We were pushed to do, like, why aren't you guys doing this already? And we're like, yeah, why aren't we doing this already? And we implemented that between the last conference and this one. So I think having good ideas come up from wherever they come up, students, staff, and being open to them and acting on them where they make sense. Again, then patients see what we're doing and they can become additional advocates. I think it's a little hard to take people suffering through a disease process and try and turn them into an advocate for climate change. But I think it's easier to get donors to do that where you have time and they're not in an acute disease process to talk about the impacts of climate change on human health. And I think that's a really good way to get former patients who are current donors to really support this effort.
I think we may not be doing anything specifically in that space, but I think I'll take that question as a call to action, maybe to think differently around how we do our community health needs assessments, and then how we report back in terms of our community health benefits, in terms of our public reporting. I think the call to action, as David was just saying, in terms of asking our patients to do something when they're actually engaging us in a different channel, might be an interesting challenge. I don't think it's impossible, but it would take some thinking in terms of how we would do that thoughtfully. But to take the step beyond making them aware of what we're doing to asking them to help, I think is an interesting challenge for us, and one that I think is worth further discussion and evaluation. I'll take that back to my team to see what they think about that, because there could be some natural thinking that would extend from our community benefits work that would be a good avenue to sort of channel that effort.
I would agree with Paul. I think that's absolutely right. And I would actually state, at least at UCSF, it's a bit of a gap. It's just something we hadn't thought of. It's a great idea. I think that there are models for this. We've, as health systems, evolved to think about models of wellness that take a much more community approach. And the UCSF faculty are the entire faculty at the San Francisco Zuckerberg General Hospital, and we work with a lot of folks facing chronic conditions in that sphere. And I think that there is an absolute link, as David has said before, between the continuing dynamics of climate change and chronic conditions. And I think we really could look at that. I really do. And I think it's a variable that isn't there, but we need the help of people like Vivian, because I kind of come back to this and say, there is no call to action on this where we're just going to figure it out, in our conference room by ourselves. I think the students give us the energy, but I think the solutions are outside our four walls to meet the community where they are. Because as Paul and David said, it's a tough channel in the moment when we're meeting them. They're there seeking help for a different vulnerability in a different moment. And but that doesn't mean that we don't want to have a relationship with them when they leave. And I think this is a real opportunity. So great idea.
One thing I wanted to add to is just, I think for us, we think of organizing as being very relational. And so I'm just struck by, how we're thinking about, within the healthcare institution, there's lots of relationships that patients might experience, with their provider, their individual provider, as well as the institution as a whole. But I know with our organizing work, that relationship building piece is very important. And then of course, we do a lot of work in supporting people's leadership development so that they can actually take their stories, the stories of the impacts on their health, their families, the stories of what they want to see in their communities, and then to really support them to be able to bring that, to decision makers, whether it's, testifying, in front of a legislative body, or speaking to reporters about the issue, or going out in their communities and organizing other community members they know and their neighbors to join in the campaign. But I think that underlying all of it is this really strong relational piece, and the connection, right? And then providing some of those opportunities for folks to really lean in and feel into their leadership. And so, yeah, it's just something I wanted to lift up for reflection, because I think that is at the basis of so much of what we want healthcare to be as well, is to really provide for that strong relationship. So I'm very curious to see how an organizing model in a different kind of institution could look like. And happy to share, at any time, some of the models that we've built in our organizing institution.
Thank you for that, Vivian. Thanks to all of you. Believe it or not, our time is up, and I'm sorry because there are some great questions in the queue, and I'd love to have another couple of hours to listen to you talk about that. But thanks so much for all the information you shared. The beautiful engagement showing up here today is fabulous. and for the wise words. And it is my pleasure to hand it back to Dr. Lisa Patel to close us out. Thank you all very much.
Thank you. And I think we mentioned at the beginning, this is our third year of doing this, and it's been pretty amazing to see what grassroots effort plus bold leadership has led to. So we're super, super grateful for your engagement on this important topic. From here, I'm just going to invite folks to join our happy hour. We have 8 different rooms for folks to connect with other colleagues and other organizations that are working in the space around advocacy or finding other people at your institution to connect on various projects. I put that link in the chat there. And then I want to encourage folks, let me just share the screen to get CME credit. Apologies, one second. So we can drop this in the link as well, how to collect your CME credit with all the instructions here. And then here are the rooms that are going to be offered for the happy hour. Save the date, we'll do a mini symposium sometime in the winter where we often have just a short 1 hour during lunchtime with a really fantastic speaker. Thank you again to all of our healthcare CEOs for joining us. Thank you, Vivian and Kathy, for joining us as well. And we'll see you at the happy hour.
Thank you, everybody.